Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer, and this is pre-conference for the week of February 23rd through whenever the week ends. So I'm not in clinical, I'm teaching fundamentals, so we don't go to clinical for a couple of weeks. So for this week, current events, it's something that I spoke to my students about, and I just like to continue the conversation here. And it really is about women being assaulted by their OB GYN or being assaulted by any physician. So it was in the news again this week. But, when celebrities, unfortunately, high-profile people get press, then the average person, I'm not average, nobody's average. We're all kings and queens, watch The Crown. But people who society is deemed as celebrity, they may get some attention. And I use it in a good way. So some of the things that we've addressed in healthcare has only been addressed because it affected some high-profile person. So if that's what it takes to bring attention, great. So the reason why I'm talking about this is Evelyn Yang, who's the wife of one of the individuals who want to be president. Yang is his last name, not sure his first name is. Anyway, but Evelyn Yang, his wife, recently revealed on a news source that she was assaulted by a doctor, Robert Haddon, H-A-D-D-N, well-known physician, OB-GYN, that out of Columbia Hospital. And when you listen to what she says, it's just a reminder that we should not judge because we don't know. It's easy for us to think that, the women who are abused are those with no insurance or Medicaid or appear to be a victim. Well, you're all a victim. And what this lady described would make, oh my God, she went to this physician in 2012. She was pregnant with her first child. She went to this physician after he was recommended highly. And she said initially everything was fine, but she noticed over a couple of visits he started having sexual talk with her, want to know about red flag, asking about their sex life. I'm pregnant. That's all you need to know about my sex life. Red flag. And what she said, she was 7 months pregnant, and it had gotten to the point where she was assaulted. She was assaulted. He said he grabbed her, said that she needed a C-section, and he examined her without gloves. And as much as that just makes me want to vomit. And of course, we're all sitting there like, girl, did you not kick him? Easy to say what you would or would not do. So I'm looking at this as a week. Let's have a conversation about this week. Should there be a law? Is there a law that says somebody needs to be in that room when a woman is being examined by a gynecologist? Male or female. You can be abused by females too, but the likelihood that the perpetrator to a woman is going to be a male, well documented. And think about it for yourself. When they have you down there in the stirrup, do you know what's going down there? Are they taking a picture? Are they inappropriate? In the average doctor's office, who is the person there? Is it a nurse? Many doctor's offices don't have a nurse. They have a medical assistant. They may have some type of a tech, but Miss Evelyn Yang, I'm glad you had the courage to finally talk about this. I'm not going to use any names. I'm a nurse, but I'm human. So this person is in jail, or prison, wherever he's supposed to be. Let's hope he gets some examination up there. I'm just saying. But I'm glad Miss Yang had the courage to finally say it. And I want us to remember, don't judge. We talk about empathy, but, let's hope you're never in that position. But on this side of the bed, as an advocate, if you have a patient who is nervous, perhaps you be a present. Offer, I'd like to come and see when you're examining my patient. You really should advocate for your patient. So that's the conversation this week. The issues and the abuse that may go on for some patients when they go to an OB-GYN and some inappropriate behavior. This really brought me to mind, if this woman, Evelyn Yang, educated, has resources. Luckily, after that, 7 months after that assault, she went to a different doctor. But think about those young gymnasts that were sexually assaulted. I don't sugarcoat this stuff. We put pretty terms on it. They were sexually assaulted. Call a spade a spade. If it quacks, It's a duck. And they were assaulted by this doctor. Imagine these young gymnasts, 10, 11, 12. Their parents trust them to this person. So if an adult, such as Miss Yang, didn't have the courage, the strength, the fortitude to kick this POS in the face and call the police, how do we expect these 9, 10, 11, 12-year-old gymnasts to do? So we all need to keep an eye out for women and children, boys and girls. Look for those red flags. And if it looks funny, do some investigation and report it. All right, so again, ladies and gentlemen, that's pre-conference for this week. As always, if this is your first time to my channel, welcome. I hope you stay. Have a good day.